Everything your body is doing is fighting for you. It wants to maintain homeostasis. I used to believe that my body was attacking itself, but what was really happening, it was the opposite. I wasn't giving all of those mechanisms that are working in synchronicity, that are striving to keep my body functioning what they needed to be, what they needed to survive. Our body knows what to do already. But when I was staying out till 2 a.m., when I was running myself into the ground, trying to get the highest GPA, when I was living on caffeine, when I was just pounding the mac and cheese and the pizza all the time and not dealing with my stress, I was the one attacking it.
This interview is going to change lives, potentially save lives. If you have ever had yourself or a loved one who has their back up against the wall with their health, like my incredible guest here, in an MS wheelchair, on the kidney transplant list, nearly dying twice, and you're following all the rules and you're doing what people tell you to do, and it is not working, and you are looking at how can I take that and transform that and alchemize that. And our guest here has gotten herself out of the MS wheelchair, overcome a multitude of autoimmune conditions. She has such a powerful story to share, but now she is helping others make their path and journey easier because she went through that jungle that you're facing with the conflicting information. And she has such an incredible way of cutting through the noise, making it simple, leading with love, and shining her light. And I just want to give a massive, warm welcome and appreciation to an amazing leader in health, Kim Eallonardo. Welcome, Kim.
Hello. Hi. Thank you for having me.
Well, you are just, you're stunning. Your story is phenomenal. You've been picked up and been featured on a number of outlets, Tiny Buddha. You're on page 14 currently of Forks Over Knives. Article. They have a whole spread about you, your story, and the power of nutrition. But you'll be the first to say it's not just nutrition. As a mentor to health coaches, I get to hear some phenomenal stories of transformation. And Kim, yours is one of my favorites. It's just so profound. And you're such a, you know, quiet, I'm going to say introverted person by nature, but you are a force to be reckoned with. And I really, really love what you have to share. So take us back to, what was life like before your illness, and what were you doing? You're merrily going along on your life, and then boom. So tell us, were you interested in health? Were you on the road to become a health coach back then? Or tell us, what was life like leading up to your illness, and then tell us how that changed everything.
So, no, I wasn't on the path to be a health coach. In my 20s, I was doing well. I always say I was living the dream. I had just finished my master's in early childhood special education. I met my husband. I was in early childhood education working with neurodevelopmental disabilities. And we bought our first house. We had three beautiful little girls. We had two gorgeous German shepherds. And I couldn't have asked for anything more.
Mhm.
It was perfect. In childhood, I had little things going on. When I was real young, I had tics. And then in middle school, chronic migraines set in. And then by high school, I developed shingles and had a really, really nasty case of shingles. Um, by the time I had just finished college, I developed my first autoimmune disease, which was Raynaud's disease. But I was still functioning. I was actively living, going to the gym, just building my dream life.
Mhm.
But it really wasn't until after the birth of my third daughter that things really got tough. Um, this unexplainable level of fatigue and weakness set in. It's undescribable. But my migraines became unbearable. I had severe joint pain that set in. That really limited my activities, and I was getting cortisone injections for those. And that was so severe. I remember one night I actually had to call my husband home. He was on a night shift, but I got stuck on the stairs because the pain was so bad. So I was sitting there crying on the stairs. I had my 4-year-old go get my phone and I had to call him and he had to carry me up the stairs. He went and grabbed all the ice packs that he could find and then got the girls to bed. But so that was intense. But at the
Mm.
same time, I was developing skin rashes. I had insomnia. My blood pressure was incredibly low and I was anemic. I had digestive issues and neuropathy. My hair was thinning. I had vertigo. So I could barely take care of myself, let alone my kids.
Mhm.
But over the course of about 8 years, I saw 13 or 14 different doctors. I honestly, I
Wow.
stopped counting after 12.
Yeah.
But my diagnosis began with low iron. And eventually I was sent to rheumatology, who said I had lupus. And they said I had rheumatoid arthritis, but I was doing all the treatments, but my symptoms kept getting worse. So eventually I was sent off to neurology and I was diagnosed with neurological Lyme disease,
Mhm.
and they found hypothyroid. But then as the weakness in my legs and my hands continued and I was falling over and passing things out, and I remember just like making dinner and dropping things. They ended up doing a spinal tap and a brain scan, and then they diagnosed me with MS. So in the midst of all of that, I developed a pretty aggressive tumor it was kind of, the doctor said it was coiled around the peroneal nerve that runs in the back of your leg. So that grew from 2 to 9 centimeters in less than 6 weeks. That was an intense surgery, a very painful surgery. But that left me with CRPS. So then that was probably about a year after the MS diagnosis. I ended up losing vision in one of my eyes. And by that time, I was in a wheelchair if I had to leave the house. I used a walker in my house and I gained about 45 pounds of fluid. Um, Eventually, the night came where I was rushed to the hospital and they found a blood clot in my leg. I had pleurisy, my liver wasn't looking good. And despite all of that, the biggest surprise to me was that my kidneys were failing. So, what happened was after a couple weeks in the hospital, I was able to go home. They would send a nurse and an occupational therapist. And at that point, I was done. I
Yeah.
said enough was enough. So when I was in the hospital and stable enough, I actually had my husband bring me a few articles and texts that I hadn't gotten to yet. So I was constantly researching, but I was to the point where I was researching the research that I was presented. So I was digging into the
Mhm.
journals
Yeah.
rather than taking everything I was told at face value. So I stopped listening to everybody else. And I kind of, at that point, I knew what I needed to do. So eventually, slowly, I was able to not use my walker anymore. I could stand in the shower by myself. Um, a little later, I was able to prepare more meals and do a little laundry here and there. And then shortly after, I was able to do lessons with my kids for school. And then by that summer, was a few months later, I went on my first bike ride down the canal. And yeah, the rest was kind of history.
Wow.
So,
Tell me, like, what was the time frame from, say, I mean, there was a smattering of things in childhood, but say from that first Raynaud's diagnosis to being on the kidney transplant list, like, what was, like,
oh,
how long, over what time frame was that? It sounds like a rapid decline, but over what time frame was that?
the ticks was in excuse me, early elementary school.
Hmm.
Um, the shingles and the migraines were in middle school. And then Raynaud's, that first diagnosis, I was about 25.
Hmm.
And then this all happened, I was 39.
Okay. So
So,
so it just kind of went from bad to crazy worse.
yeah.
And then And I think that's kind of, I mean, in a sense, you get acclimatized to a new, not good normal. And I
A
think
new
that,
normal. Yep.
yeah. And a lot of people out there might be suffering with, one diagnosis. Maybe they're at that first Raynaud's, or maybe they're at the first autoimmune, or the
Mhm.
Hashimoto's, or one of those. Um, and so, this is exactly what they're trying to avoid,
Yeah.
having it go off the rails. And I think they've probably encountered seeing so many, doctors and so many appointments, and really just getting very confused. We're going to dive into sort of, the mess that makes with your mind, just having to go through that journey, um, and the terror that can occur. But then what was the from say that decision, that line in the sand where you're like, "Hey, I'm not going to accept everything at face value." And well, let me just ask you, what did you find when you started researching the research, as you say, and dig deeper to say, what are they basing this fact on? What's the study? Show me the evidence, because a lot of times we hear somebody that we respect say XYZ, and we just assume, or there'll be a headline, and we know
Mhm.
how misleading headlines can be sometimes. If anybody's fallen for clickbait online, a headline doesn't tell the whole story. But a lot of times, even as doctors, mainly you can read the headline, the abstract, the conclusion, but to go through every article. But when your life is at stake, like yours was, that's what you did. You dove into
Yeah.
saying, well, why are they saying that? What was some of the, what did you find? Just, not even the specifics, but was everything exactly as it seemed, or was that not the case?
No, that wasn't the case. So, um, you know, my life was like literally dwindling away, and I had a little girl that was kind of going down the same path, but I just wanted to live. I know everyone just wants to live, but I just wanted to,
Yeah.
like, the little things. I wanted to be in the sun and on the beach and ride my bike. But
Yeah.
the whole time in my mind, I had it in my head that I just have to figure out what this is. If I have a label, then someone here could fix it. But during that whole process, I realized that I gave the authority of my well-being to everybody else,
Yeah.
and allowing everyone to compartmentalize my symptoms, because that's how I was taught to think. I mean, I feel like we're kind of brainwashed to do that these
Yeah.
days.
Yeah.
Um, and when I say everyone, I don't mean just doctors. It was well-meaning friends and family. It was podcast influencers and social media and genetic testing, you name it. It was like everyone had one magic pill or one intervention or one biohack that lended itself to one symptom or one
Mhm.
disease. And that's the approach that literally almost killed me. So, what
Yeah.
I found was that there really isn't a magic pill. There wasn't one therapy, or there wasn't one macro or one micronutrient or one vitamin to heal something so incredibly complex.
Mhm.
So, what I ended up finding was ultimately kind of three core components. So, the first thing I found was nutrition. And what's interesting is that what I was taught didn't align whatsoever with what my body needed. So, it didn't really align with the fads that I was seeing online and being promoted. It was really a much more individualized, holistic, and nutrient dense approach. The
Mhm.
other thing I found was how important cleansing is. So, as I went down that rabbit hole of potential triggers for chronic illness,
Yeah.
I really had no idea what kind of chemical and pathogenic warfare that our bodies are exposed to without even knowing it. So many of the products and the sprays and the items these days can kind of been subliminally introduced to us, and we oftentimes are unknowingly putting these very carcinogenic substances into our body.
Yeah.
And unfortunately, a lot of times we don't have a choice with what we're exposed to, and they're accumulating faster than what we can excrete.
Yes.
Um, and then finally, the last piece I found was mindset. And I know it seems like kind of crazy, like how can, the way you think about something be connected to disease, but we're really never taught how the perception of stress or how we think about the world around us can influence the central nervous system. So you can potentially trigger this cascade of effects that will then trigger genes that would otherwise stay dormant. And they can promote inflammation and then lower the immune response. So if you're not accounting for this piece, you can almost undo half of, and I actually did undo it at one point, but you can undo half of the work on your lifestyle and cleansing and the nutrition that you've put into it.
Yeah. Wow. So I just want to pick up on, we talk about nutrition a lot on this channel, and a lot of people talk about that and how it should be bio individual. And I know you're like all on board with that and holistic approach. But the cleansing aspect isn't something that not everybody really dives into. And sometimes more of a, on a superficial level, like don't bring in toxins. But that's one of the differences, I would say, that you talk about. You just go into more depth in that, in your symptoms that you had, and your life-threatening illness was more severe than sometimes some of the people that we're talking to. And so that required that next level. But I remember looking at, there's an environmental working group that looked at fetal cord blood, like the umbilical cord blood. These babies haven't, you know, put on makeup. They haven't eaten
Mhm.
any junk food yet. They haven't breathed any air yet. And they already found within the baby, the fetus, 287 chemicals.
Yeah.
And a lot of them were carcinogenic, neurotoxic, um, crazy. So you're right. These toxins are ubiquitous. We are going to be exposed. And so having a way to address that. And I like how you, like, when you find yourself in a position where you're really fighting for your life, you're like, why is this happening to me? Like, what did I do to deserve this? These thoughts are like, well, what happened? Like, if I trip over a rock and I fall and break my leg, I get that. I understand how that happened. But if my health is unraveling before my eyes, and I was just minding my own business with my great husband, my three beautiful daughters, and my two gorgeous German shepherds, what the heck? What the heck happened? And so it causes one to notice something's not right here. And as people who we tend to look for, what's that root cause? What's the root cause? And where are we at? And that's when you came to realize, like, even if you're eating all the right foods, even if you're doing all the right things, we still are exposed to toxins. And it's like, well, why do I have that pain? Why are my vessels reacting this way? Why do I have this tumor that's growing? Why is my body going through these things? And I mean, you were forced to be curious, but you had your master's already. Like, you were an educated woman who likes to seek out the research, look for the science, but also caring. A mom in working in child development and all of that. You were almost primed for having the curiosity, the skill set, the ability to go research. And I can imagine that was not easy. I mean, it's one thing for you to say, I'm going to research the research. That's one thing for somebody out there to say. But when you can't make dinner, when you can't even stand, uh, wow, like to dive into it. And I guess you did it because your life literally depended on it. Yeah.
I kind of thank goodness for my husband who took over everything, but my whole I just had this drive. You have kids and it's like mama bear, and
Yeah.
no one can take better care of my kids than I can. So I wanted to get up. I definitely wanted to, but I had those three little girls and a husband that loved me. So
Was there a last straw? Was there a time period when you're like, all right, that's it? Like, I mean, you're going to research your research, but
mhm.
anything else that if you had to pick out all of the things, which one thing was kind of like the biggest lever that turned the tide into the health direction?
I had to let go of everything. All
Mhm.
those mom expectations, the wife, the Pinterest boards, it all had to go away. The judgment, the keeping up with the Joneses.
Yeah.
I had to do what I needed, what I knew I needed to do in my gut. And that meant putting my kids aside for a little bit.
Yeah.
And I used to catastrophize. And if I don't do this, they're not going to graduate school, or who
Yes.
knows what's going to happen. But it's like, take a step back, Kim. They're going to be okay. Who's not okay is you.
Yeah.
And you're not going to be there for them if you don't do this. So
Yeah.
we're not going to go to dance for a little while. We're not going to go to soccer for a little while. Dinner's not going to be picture perfect for a while.
Yeah. And I think that's really important because we have such a strong sense of duty as mothers. But if we sacrifice ourselves in the process, I mean, you're evidence of, well, then you can't even make dinner. You can't even take care of yourself. You can't even walk up the stairs yourself. And then you need others to take care of you. So my little saying is be good for you. You first have to nourish you
Yeah.
so that you can give from the overflow. And, as generous, moms and caregivers, it's a bit of a setup. So yeah, good for you. So what had you go from that really life altering experience to say, I want to become a health coach? Tell us about that journey.
So I never knew what a health coach was.
Mm-hmm.
And my original game plan was just to get my master's, to have a few babies. And then when they were in school full time, I'd go back. I wanted to go back for my PsyD. I always thought when I got better, I would get my PsyD and then I'd go back into the educational setting consulting for districts around the county.
Mm-hmm.
But I mean, the struggle, trying not to die, kind of consumed me for years. It
Yeah.
was a good 8, 9 years. Um, so I know what it's like to wake up and get ready for your fourth doctor appointment that month.
Yeah.
And I know what it's like to wonder if you're going to live long enough to see your little girls grow up and get married or
Yeah.
whatever it is they want to do. I know what it's like to trial and error every trend out there and have everyone tell you what to do and how to do it and when to do it and how to think about it. And I know what it's like to also want to give up and be free of that pain permanently.
Yeah.
Um, but I also know what it's like to be on the other side, to get
Mm-hmm.
rid of that wheelchair and avoid the transplant list, to wake up and have the energy to make it through my day. Um, So now I get to go to bed at night and I get to think about how lucky I am, even though sometimes I let my mind wander and I get overwhelmed. But I can think about how lucky I am to be able to take my girls to their dance class
Yeah.
and make it to their recitals. Because I would always watch everyone else pick my daughter up and do her hair and her makeup for the recital. And that was devastating.
Yeah.
But the best part is that I know I have the tools to stay healthy now. And I want that for everybody. No parent should ever have to go through what I did or my daughter did. And I see a really huge gap in our healthcare system, which is really an incredible injustice. And so many moms and their spouses and their children are suffering because of that. So if I can fill in that gap, then that's why I
Yeah.
do it.
Yeah. I it is why I do what I do.
Mhm.
That's why we have the Health Professional Academy where we help amazing health coaches like yourself get their important, powerful messages out there in the world. It's bad enough that you had to suffer through it the hard way. But then for you to reach back around and help somebody else, that's how we alchemize it. And then it's not like everything you went through, was a waste. It is a way um, to give your life meaning. And then all of a sudden you think, maybe I was supposed to go through this journey. Maybe I was supposed to do that so I can shine the light, lead the love, show the way for other people, be that beacon to guide others. And there is a huge gap in our healthcare system. Over half of people have at least one chronic disease. Over half of people. And
Mhm.
it's taking up 86% of the healthcare dollars in America. And that's a huge, number. And it is accounting for 74% of deaths, these chronic diseases, these, including autoimmune, cancer, heart disease, diabetes. And the medical system, as well-meaning, I mean, I was a medical doctor for 25 years. So I went into medicine to help people be healthy. That's why I went in there. I thought I could just go in there and fix people. And people think they can do whatever they want to their bodies and they'll go to the doctor and they will fix them. And that's not actually what happens. Your body is actually the miracle that heals itself if we give it half a chance. If you break your bone, you go to the doctor and the doctor can put the two edges and line them up together like this, but it's actually the body that forms the bony callus that molds it back and heals itself. We can just be the assistants. As doctors, we're assistants to set it up to try to improve it. But the medical system is not equipped to deal with half the population with a chronic, life-threatening, although it might be over a long period of suffering, disease. And so this is why I really see the role of health coaches. And you're right, nobody even knows what a health coach is. I was recently in this group a couple of months ago in LA and trying to explain how I help health coaches get their practices up and running and thriving and get their message out there. And people looked at me like I had two heads, like, what's a health coach?
Yeah.
And so I see a day when there's a health coach in everybody has a health coach, just like Steve Jobs saw a computer in every home. I see everyone having a health coach like they would have a doctor or a hairdresser or an accountant. It's just one of those things, and that it's customized to them, and that people, start to take take their health back, take control back. And it's not a slight against it's just like it's just inundated. Like medicine absolutely has a point, but it is at a breaking point right
Yeah.
now, and it's just overwhelming. And you get these complex patients like yourself. You would be one of those complex patients. And then you have a series of doctors, each dealing with their tiny piece of your body. And without connecting it all together and to look at it as a holistic approach. And also, it's fast. It's fast. There's so many. There's not enough time to spend with any one person. And so there's this knee-jerk pill reaction because that seems like a quick thing to do. And every medication has side effects, every single one. My good pharmacist friend told me that. By the way, every single medication has a side effect, just so we know. And so, if you need it, you need it. But what else can we do? And I think there's a huge gap with what people can do themselves. And I think it's optimizing those three things that you talked about so beautifully, that nutrition and feeling what is it that is helping their body strengthen and thrive, and also what is the mindset that is required. How are they managing stress? Stress is really our number one killer. It's the trigger. It's pulling the trigger on all these things that are the setup. And then, of course, cleansing, which, a lot of people don't even realize that they're just being inundated literally from day one with all of these toxins that can, rear their ugly head later on, especially when we haven't taken into some of these things into account. And I really like what you said about the I believe it was in the mindset piece, but where you were talking about everybody having their opinion and, just being tormented, just adding to the torment of that guilt like, what did I do wrong? And
Mhm.
what did I eat that I shouldn't have? What did I not eat that I should have? What did I do? What did I not do? You're faced with a life-threatening illness, and then we got to beat ourselves up for being stressed about that. I mean, we have to just. I love how you said, just let it all go, just let it all go and surrender. And it just at some point, and that pivot point was when you said, all right, you're going to do what you can do, but I got to quit trying to make sure everybody else is happy. I got to quit trying to make sure like it's all perfect and life is all great. And when it's not, I got to quit trying to, just prop up the facade around here. And I just got to take care of me. And that's, I gotta be good for me, is what you had to do. So it's so good. There is a gap. And I love that health coaches are perfectly positioned to fill that gap. And it's only getting bigger. The demand for health coaches
Yeah.
is growing. If you're a health coach listening to this and you're like, hey, I got a message too, I want to share it, check in the description. There'll be a way to give you some information on how you can get your healing gifts out into the world, ignite your health coaching practice like Kim has done. So tell me, what exactly do you do now? How do you help people now, Kim? Tell us a little bit about that.
So primarily help women with kidney and autoimmune disease optimize their kidney function and boost their immune system so they can get back to actively living their life again. So we want to get them out of their new normal and back to their old one where they're not watching their life go by from their couch. It's really so fulfilling. It's amazing to see them kind of rise out of the ashes. And what's really wonderful to see too is I've been working with children now and just seeing them blossom. And when you see a child in pain and struggle, it's like the hardest thing on the planet. But to see
Yes.
them come out of what they're struggling with is just,
Yeah. Soul
there's no words.
satisfying, as I call it.
Yeah.
Soul satisfying. It is incredible work. It's just become so meaningful. Uh, and you may have just answered it, but I, what do you like best about being a health coach? I mean, obviously, seeing these kids transform. I guess that's really, it really is what you're saying. But if there's anything else you'd like to add about, what's your favorite part of doing this work?
I love that I get to fill in that gap. I don't like when I see injustices out there, just kind of why I got in the education field to begin with, but I get to fill in that gap. And it's sort of selfish because it just makes me feel good. Like I
Yeah.
said, seeing the kids and then seeing these women they just want to take care of their kids.
Yeah.
And when they can do that again, it's amazing. And there's this ripple effect because when one person's sick, I don't get to just see that one person. I hear the stories of how everyone around them is doing better.
Yes.
So,
Yeah,
and
if
then
one
it's
member of the family is seriously ill, it is affecting all members of the
like,
family significantly. Yes, but then the ripple effect, when one is better, everybody's lives are improved. Yeah, it's just exponential. And as moms, you can feel so helpless, and you want absolutely what's best for your child. And to just you're looking, the mama bears are looking, how can
yes.
I how can I help my young have the best option? And when your best options that you're being presented with suck, what else is there? When your back's up against the wall, you're on the ropes, what do you do? And I think that's one of the places where you really shine. I mean, because you've had some serious illnesses yourself, and with your family, but even amongst your clients, and it's just tremendous. Of course, we don't we don't want people to have those serious illnesses,
No,
but
no.
if you but even if it's this a slightest thing, which I mean, it's only relatively, but if it's a chronic condition, it's significant and it's affecting the whole family. So, I know working with health coaches and helping them create their practices, there's things that I learned going through and becoming a successful health coach, but then helping others do the same, I learn even more. I'm never not learning, and you just got more of a a data sample to pull from, and you start to learn anything. What's something you've learned from working with the clients that you've had that you're like, here's something that I've discovered.
Yeah. So this is something I didn't do for myself. And after working with people, I've kind of realized, but when you're going through this process, you have to, what I say is, pave your path with grace. You have to have compassion for yourself in the healing process. You have to free yourself from the judgments that we so often hold and kind of open up to the possibility, okay, what else is true? Because those who have been sick for a long time, we
Mm.
tend to internalize our illness as who we are. So it's really important to um, see and work with who you are without that illness.
Anything that you've learned, like, that you wanna share in terms of, like, tips or, maybe even some practical tips? Because this is all good, but what
Yep.
about something that they could do,
Right now.
or yeah, right now, or that you could point them in the direction of, whether it's nutrition or anything that you're like, well, here's something. I mean, already what you've shared is valuable about letting go and surrender and paving your path with grace. But anything else in terms of nutrition or something like that from
Yeah.
your perspective, because you certainly have immersed yourself in the research.
Yep. So I would say a lot of us these days know and have heard how inflammatory gluten and dairy can be. So that's always a great place to start. Um, but what most people don't know is that by simply reducing the amount of animal-based foods will significantly decrease the load of waste on the kidneys, and it will decrease the inflammatory pathways that tend to lend themselves to autoimmune disease. So when you're increasing the plant-based foods, you're increasing phytochemicals. So you're consuming more of the plant-based foods. And I'm not talking about, I know there's a big trend right now in like McDonald's and Chick-fil-A, and they're saying plant-based. That's not what I'm talking about. I'm talking about whole, fresh veggies, fruits, legumes, because when we do it that way with whole foods and not the processed plant foods, we're introducing a more alkaline environment
Yeah.
and automatically reducing sodium, which is a big trigger for both chronic kidney disease and autoimmune disease. You're automatically reducing the refined and processed sugars. Um, and one of the things I really try to stress is so many people are afraid of sugar. It's the processed sugars. When you have autoimmune and you have kidney disease, you need the sugars from fruit. Um, but I'd say one of the biggest tips when you're trying to play detective is when you're trying to figure out what's going on, is that to remember it's never, ever, ever one thing.
Hmm.
When we look at potential triggers that may have helped or triggered something, our brain, we're like wired to go to the one thing that we just put on our skin or that we just
Right.
ate. But in reality, it could be something that's having an effect from something you did or ate 3 to 5 days prior, or even the cumulative effect of something you did or started 2 months ago. So it's really important to see the big picture.
I think that's really great advice. And hopefully people are loving this. We got lots more to come here. As someone who has been, as someone who has overcome incredible odds, who's nearly died twice, who got off the kidney transplant list, who does that and who has been able to get out of the MS wheelchair and truly thrive, be able to bike ride with your kids again, and this incredible journey. What would you say is the biggest myth that people have when it comes to either chronic kidney disease or autoimmune? Let's take those two. What would be the biggest myth that you've seen that is kind of a block for people to get on the other side of?
The biggest thing is that it's going to get worse over time, and that it's the only way to address it is through medication, and that you can't reverse it. I will never forget the day I sat in my neurologist's office and he said, "But you don't have MS, you have primary progressive MS. So we're done, take these meds." But really, you just have to go deep enough instead of using, a lot of times I hear people using another diagnosis as an excuse. So I'll hear someone say, well, my autoimmune disease or my kidney disease, let me back up. My autoimmune disease caused my kidney disease, or my diabetes caused my kidney disease, or my gut health caused my autoimmune disease. But really, it's kind of like, okay, well, let's look at that deeper. So if you're saying your gut caused your autoimmune disease, well, okay, let's look at what caused your gut problem. If you're blaming your hormones, let's look at, okay, what caused your hormones? There's always
Another
something
layer.
to peel back.
Yeah.
Yep. So these things don't just happen. It's not just one thing. It's this perfect storm. And so, yes, you can heal. I am living proof of that you can stop the progression. You can actually reverse it.
Now, I know you also had shared with me earlier a myth, but you said it's a little bit controversial whether you want to share this one. But you, I think somebody who's been able to get out of the MS wheelchair and get herself off the kidney transplant list, I think you get to share your opinion because obviously your results are not like everybody else. So no doubt you have a perspective that is not like everybody else. So share that other myth that you were a little hesitant to share, because I know you're not one to try to strike up controversy, but tell us the way that you look at things that might be a little bit different than other people are looking at it.
So we're taught that our bodies are attacking themselves, but technically it's still really a theoretical construct. If we really look at the human body and how miraculous it is, it's doing things that we can't see under a microscope yet. It's so outside of our human abilities to see what the universe is even telling it to do. So, for example, you can look at our pupils, they automatically dilate when it gets dark. You shiver or get goosebumps when it's cold. You automatically release adrenaline if you're in danger and you've got to fly out of there. You spike a fever if you have an infection, and your heart rate increases to get more oxygen. Everything your body is doing is fighting for you. It wants to maintain homeostasis. And while under a microscope, we can see some of the mechanisms that are driving these actions, we're still really in the dark on what's even driving those mechanisms to know what to do. So
Yes.
I always kind of look at everything now with, we don't know what we don't know. So I try and be open. But I used to believe that my body was attacking itself. I remember posting on social media that my superpower was I could attack myself from the inside. But what was really happening, it was the opposite. I wasn't giving all of those mechanisms that are working in synchronicity, that are striving to keep my body functioning what they needed to be, what they needed to survive. So our body knows what to do already. But when I was staying out till 2 a.m., when I was running myself into the ground, trying to get the highest GPA, when I was living on caffeine, when I was just pounding the mac and cheese and the pizza all the time and not dealing with my stress, I was the one attacking it.
This makes so much more sense. This intelligent body that, has all of these involuntary workings beating your heart. We don't have to tell it how to do that. It functions. It is very intelligent. And to say, "Oh, you silly body, you don't know what you're doing. You got it all. You turned on itself. You went rogue. You went rogue, and you're like a robot that went rogue, attacking itself." That's doesn't sound doesn't sound necessarily, and it's like, we got to come in there and we as humans got to tell you, body, how to run things. That doesn't sound nearly as plausible as what you've just shared, that the body's intelligent and it's doing things for a reason, the best it can, despite our all-nighters, despite all of the toxins, despite all of the stress and the conditions we put ourselves in. But when we know better, we can do better, as Maya Angelou said. And that's what you've now know better for you. And you're not even saying, hey, this is, you got to eat this diet, or you got to eat this, do this exercise. That's not what you're saying at all. But you're saying, like, allow your body to tell you, to guide you, to let you know, hey, this is working or this is not working. And your last tip there was saying, hey, and it's not necessarily just the last thing you ate. Like, you might have to expand that window when you're doing your detective work, which is really helpful to say. So good. So good. If you are listening here, and pop in the comments, what's your experience? What's your opinion? What do you think about what Kim just shared about autoimmune? And have you been told autoimmune is just your body attacking itself? And do you think it's, yep, that's what happened? And do you think the symptoms are just because of the label, or do you think that it's working, it's trying to keep the balance despite all of this, and it's the second option, that it actually is very intelligent and that there are things that we can do, and so that your body isn't attacking itself, but we're kind of attacking our body, or at least not giving it the tools it needs to be able to function properly. What do you think? I'd love to hear from you in the comments. And it sounds a little bit crazy that this is controversial, but we'll see. We'll see what happens. We'll see what our audience thinks. So, how have you grown as a person through the process of becoming a health coach? I mean, it really is its own journey of personal development in and of itself. So, what are some other things that you've seen that have improved for you as you've gone through this journey of helping others?
Part of it is just kind of coming out of my shell a little bit. There's a little bit of, I guess you could say, cognitive dissonance. Part of me, I really wanted to, fill in that gap. And I don't like when I see an injustice.
Yes.
But at the same time, I don't want to be out there a ton,
Yes.
but I had to do that. So that was a big growth spurt for me, doing the magazine and the Tiny Buddha and the podcast interviews. So I think that's how I grew the most.
I've been working with you along your side as you've gone through and written those articles, done those podcast interviews, and now with your article in Forks Over Knives. And I know it's not in your nature to be confrontational or even to speak out. And very much, and I think a lot of people can relate, they just want to, let's just everybody be nice. Let's just everything just be good. Let's everything be just good. But then when you see a problem and a need and a gap, and you know how to fill that gap, the thing that overrides it is the lack of ability to just see people suffering when you know there is an answer and there's another way. And despite, I mean, you've had haters, you've had people misunderstand what you've been trying to say, misinterpret your kindness. And, and you'll do it because if it helps one person, it's worth it. And you've helped more than one person. And so because of your journey, it's helped so many, and I want to commend you for that. But I have witnessed this transformation in you, where you are full page in Forks Over Knives. There's more than a full page, but a full page picture of you. And that's for someone who's shy and likes to just kind of be behind the scenes. That's a big growth spurt. And I know for myself, I'm actually introverted, but I call myself a situational extrovert, which is exactly what you are. So if the situation requires it, I will override that and I will do what needs to be done and I will say what needs to be said because it's the right thing to do. And if I can help, if I can lend a helping hand, I'm not going to hide.
Yeah.
And when I have something of value to share, I'm going to share it. And then whether people do it or not, or like it or not, that's none of my business. You know, they can take it or leave it. But if somebody's suffering, I know how much I would have appreciated if somebody else had overcome something that they would show me the way that, you know, success leaves clues. And I know trial and error is awful. And when you are suffering with a health challenge, you might just not have time for all of the trial and error. You know, you might run out of time before you get some of those solutions, so that if we can, you know, hasten that, you literally can save lives. And it's so important. And so you know it because you've seen the transformations. And that's why I keep doing what I do, despite the haters or the comments of people who they're just looking at life in a different way.
Yeah.
And feel the need to let you know about it instead of just scrolling on by if they don't agree with anything, with something. And I think so I want to commend you for that because it is the right thing to do. So good for you. If you had to go back and talk to your former self, you know, you've been through so much. Any advice that you would say to pave your way, like you know, any advice you go back and give yourself?
And it's not a big lengthy thing. It's just let go. Let go of all of the expectations and surrender. And I think our intuition and our guts are underrated.
Mm-hmm. Yes.
For the longest time, I knew everything that I was taking was, it wasn't right. And I
Yeah.
knew it,
Yeah.
but I didn't go with it. And there was other things I could have done. So let go of those expectations. The world will continue without you.
I think that's really important. And I think everybody can relate to a time when they had their gut told them, you know, their instinct said, I should do this, or I shouldn't do this, or I shouldn't follow this, or I should follow this. And we ignored it. And then it came around back to bite us. You know, it could have been easier, which is okay. We're always learning. And I think that's going through some of those things is where you get to learn how to listen to that still small voice inside. Usually, sometimes we don't even hear it, but the fact that you kind of heard it is good. And then the next step is to listen to it and trust it. Trust it. And is it the fear talking, or is it, you know, that sense that, hey, this isn't right? And it's so profound.
We're listening to everybody else. Like we were talking about earlier, everyone's
Yes.
shouting at you. So it's trusting in yourself and calming that storm that's like, you're here and there's all these people and these medications and influencers and telling you what to do. And just, it's like, go away
Yes.
and breathe.
Yes. And well-meaning as they are. And it's where somebody will post something they're going through, for example, on social media, and then they'll get 100 people telling them their opinion of how to fix it, which you can't put a fix in a comment line. It's not like that. If that was that easy, well, then great. But it's not like that. And it does get overwhelming, and it adds to kind of the tornado, the torment. Yeah. When helping, that's my favorite question to ask. When you're helping your clients, and you're helping them with whatever they initially came to you for, I know there's always spin-off benefits, because just like the worse it got for you, the better it got too. And that's same for your clients. So I love hearing the stories of the spin-off, unintended great consequences, the collateral beauty that we see. Share some examples, if you would, of some of your clients and some of these spin-off benefits?
I had, one mom, we're working on lupus and fatty liver, and that is, of course, our main focus. But once she kind of modified her diet and made some changes, things like unwanted hair growth went away. Her skin was more clear and her pants were falling down.
And that's cool. I mean, that's really great because when she's coming with lupus and fatty liver, that's the more serious issue. But
Yes.
also, oh, the thing that she also really, really wants is, you know, those other things, her skin to
Mhm.
be better, get rid of the hirsutism and to lose weight. I mean, to feel to have that, that's just such an incredible bonus. Some people want
Yeah.
that, but that's just the side bonus. Yeah, carry on.
There is one child I was helping with eczema. So we're working on his skin, but one of the things his mom said after maybe 4 weeks of working together, she said he would constantly raid the cupboard. He was always looking for some sort of treat, but he stopped having those episodes of those intense cravings, and he was kind of more calm and content surrounding the food that he was eating.
Mhm.
Um, his whole family said they noticed that his gassiness went away. And then some of the other things are with other people that I just came across was they realized their gums and their teeth hurt less. Another thing is urinary frequency. We never set out to address that. It's always like the MS or something or the Crohn's, but
Yes.
that's another spinoff. And then there's always my daughter. So she has CIDP and POTS and a whole host of things, but we were really wanting to decrease the neuropathy and the hot flashes and the fatigue. And she also has really severe eczema, but we ended up helping the eczema. And then there are, my clients that come to me wanting their kidneys to function better. And they always wind up with weight loss and better cholesterol and better blood pressure.
Yeah. The gifts just keep on giving. And then, as you said earlier, like your client gets better, but then that improves their whole family. So when that child or that, spouse or is better, then everybody's better. And yeah, everybody up levels their nutrition, everybody improves their stress. And so, yes, so fantastic. I love
Um,
it.
that was one. Yeah, the husband actually started eating like his son was, and the mom told me, said, her husband said, "How come you're making him all these gourmet meals? And what about me?" And she said, "Do you want to do it?" And he said, "Yeah." And he started doing it, and he noticed more energy. And he's like, "My brain fog is gone." So that was kind of cool too.
Well, this has been an absolute delight and a pleasure to connect with you, Kim. Tremendous story. Congratulations on all of your publications and appearances as you share this story. I know you're just really getting started in this journey. I say that only, I know you have a huge track record, but I say that only because I see such amazing things in your future as more people learn of your story and what is possible. Tell people how they can connect with you if they have questions. Obviously, if you have questions, pop it in the chat here. But how can people reach out to you and connect if they have questions or something they want to run by you?
So the easiest way is email Kim at revivetothrivewithkim.com, or you can go through my website at revivetothrivewithkim.com, and there's a little click to chat button there. We can schedule a quick call.
Awesome. So yeah, Revive to Thrive with Kim, Kim. So check Revive to Thrive with Kim.com. If you have been struggling with MS in particular, and some of you may have because of Kim's story, I want you to check out this other interview I did as well with Christina, who also had a diagnosis of MS and how she was able to overcome that and has transformed that experience for her into an incredible health coaching practice as well. So I love these health coaches who are taking their traumas, their illnesses, their hardships, their dark nights of the soul, and being able to alchemize them into something absolutely beautiful to help people and potentially you. So if you have liked this, definitely check that out. There's more good stuff where this comes from. And that's it for this episode of Health Coach TV. Thank you so much, Kim. I super appreciate you.
Absolutely.
Have a great week, everybody. And of course, be good for you.